Okay, so you've given us quite the stack of notes on endocrinology medications. Looks like we're in for a pretty deep dive today.
It is a fascinating area, isn't it? All these complex conditions.
Oh, definitely, yeah. And from what I can see, it looks like we're covering everything from diabetes and thyroid issues all the way to Addison's disease.
Those are just a few of the many conditions we'll be exploring today. What I find so intriguing is the way these medications act like a microscopic tuning fork, targeting those specific hormonal imbalances.
Ah, that's a great analogy. It really is like having a toolkit, for fine-tuning the body's internal systems.
Exactly. And like any good toolkit, we need to understand the right tool for the job. Speaking of which, perhaps we should start with something many people are familiar with: diabetes medications.
Oh, yeah, good idea. Okay, so let's see. In your notes, you've got acarbose and then a whole group called sulfonylureas. What's the connection there? They're not just randomly grouped, are they?
You're right, there is a connection. Both of those work to lower blood sugar, but they go about it in very different ways.
Interesting. Okay, so how so?
Well, acarbose, for instance, acts directly on the digestive system. Imagine it like a speed bump for carbs, slowing down the breakdown of sugars in your gut.
Oh, like a speed bump. I like that.
It helps prevent those rapid blood sugar spikes after a meal.
Which can be particularly problematic given my history of...
Oh, my apologies. I sometimes get carried away and forget not everyone knows my train of thought. It's important to manage those post-meal blood sugar spikes for a variety of reasons.
Gotcha. No worries. Okay, so acarbose is like that frontline defense then, slowing things down. What about the sulfonylureas? How do they work?
Those take a different approach. So medications like glipizide and glyburide, which I see you have in your notes, work by actually encouraging the pancreas to produce more insulin.
Oh, so they give your body's own natural insulin production a boost.
Precisely.
That's clever. But I'm guessing there's got to be a trade-off, right? You can't just force your pancreas to work overtime without, potential consequences.
You're absolutely right. There's always a balance to consider. One important thing to keep in mind with both acarbose and sulfonylureas is the potential for hypoglycemia.
Right, hypoglycemia or low blood sugar. It seems like that keeps popping up in these notes, especially with the diabetes medications. Is there a reason for that?
Well, when you're manipulating the way the body handles sugar, there's always that risk of, tipping the scales too far in the other direction. And you specifically highlighted concerns about hypoglycemia in your notes, so it's clear you're aware of these risks and are being proactive in your research.
Oh, got to stay informed, right? Now, before we move on, I have to ask, one thing I'm noticing is this repeated mention of avoiding alcohol. Like with these medications, that seems to be a pretty consistent warning. Any particular reason for that?
Well, alcohol can be unpredictable when it comes to blood sugar. It can interfere with both the absorption of sugar and the production of insulin, making it difficult to, predict how blood sugar will react.
Okay, so better safe than sorry.
Exactly, especially with a medication like chlorpropamide, which you also have in your notes. That one can actually have a rather dangerous interaction with alcohol.
Huh, good to know. So we've covered medications that work in the gut to slow down sugar absorption, and then those that stimulate the pancreas to make more insulin. Is there anything else in our diabetes toolkit that we should be aware of?
Oh, there are definitely other classes of diabetes medications, each with their own unique way of working. But since you seem particularly interested in these two classes, maybe we should move on to another area you've highlighted in your notes: thyroid medications.
Yeah, let's do that. Okay, so thyroid medications, I'm seeing medications for both an overactive and an underactive thyroid, which I find fascinating. Can you walk me through why someone might need medication for either scenario?
Absolutely. It all boils down to that delicate balance of thyroid hormone in the body.
Okay, makes sense.
So when your thyroid is overactive, a condition known as hyperthyroidism, it's like your metabolism is stuck in overdrive, leading to all sorts of symptoms. Medications like methimazole and propylthiouracil, which is often shortened to PTU, aim to slow down the production of thyroid hormone, effectively putting the brakes on that overactive thyroid.
So they target the source then?
Precisely. Now, an underactive thyroid or hypothyroidism is like the opposite problem. The metabolic engine is running too slow. This is often addressed by just replacing the missing hormone.
Right, just give the body what it's missing. Makes sense.
However, you've also highlighted some medications that work a bit differently for hypothyroidism. For example, you've got potassium iodide marked.
Oh, yes, potassium iodide. I remember reading that it can actually stop the thyroid from releasing stored hormone. It's like hitting the pause button instead of just, slowing down production. But why would you want to do that? Like, why pause hormone release instead of just slowing down production?
That's a great question. You've hit on a key distinction in how we manage hyperthyroidism. Potassium iodide is often used in specific situations where you need a very rapid reduction in thyroid hormone levels, for instance, like in preparation for surgery or radioactive iodine therapy.
Ah, so it's a short-term fix to get things under control quickly.
Exactly. It provides that temporary solution while other treatments take effect.
Fascinating. Now, this brings up another point from my notes. I have something here about potential risks with methimazole and PTU, specifically something called agranulocytosis. What is that, and why is it relevant to these medications?
Ah, yes. Agranulocytosis is a rare but serious side effect that can occur with both methimazole and PTU. It involves a dangerous drop in white blood cells.
And white blood cells are essential for fighting off infection, right?
Exactly. You clearly did your research. Your notes are very thorough.
Well, like I said, I like to be informed. But this raises another question. If these medications have such serious potential side effects, why use them at all?
Well, it's always about weighing the risks and benefits. Thankfully, these particular side effects are quite rare, and for many people with hyperthyroidism, these medications can significantly improve their quality of life by controlling the symptoms and preventing complications.
Okay, so it's about improving the patient's overall well-being, not just treating the condition in isolation. It's all about finding that right balance.
Exactly. And that theme of balance is central to endocrinology. It's all about maintaining equilibrium in the body.
Right. And when things go off kilter, medications can step in to help restore that balance. Which brings me to another section in my notes, hormone replacement therapy, specifically fludrocortisone for Addison's disease.
Excellent observation. You're absolutely right. Hormone replacement therapy is another essential tool in our endocrinology toolkit. Fludrocortisone is a perfect example of how we can use medications to replace those missing hormones and restore balance when the body falls short.
Okay, so tell me more about this fludrocortisone. How does it work in Addison's disease? And what makes cortisol so important in the first place?
Addison's disease, as you know, is a condition where the adrenal glands don't produce enough cortisol, a hormone that's vital in regulating stress, blood pressure, even your body's use of salt and water.
Wow, so it does a lot.
It really does, and fludrocortisone is a synthetic version of a naturally occurring mineralocorticoid that helps regulate electrolyte balance, particularly sodium and potassium. Think of it as providing that essential cortisol that's missing.
Okay, so fludrocortisone is basically stepping in and doing the job of the underperforming adrenal glands.
You got it.
And since you mentioned potassium, I'm noticing that I have a whole section of notes here dedicated to medications that affect potassium levels. Potassium seems like a pretty big deal in endocrinology.
You're absolutely right. Potassium plays a critical role in many bodily functions, including nerve transmission, muscle contraction, and maintaining a regular heartbeat. And it's closely tied to the endocrine system.
Okay, this is where it gets really interesting for me. Tell me more about this connection between potassium and the adrenal glands and these medications. I'm all ears.
Well, remember we were talking about the adrenal glands, those tiny but mighty glands that produce a whole bunch of hormones, including cortisol, aldosterone, and even small amounts of sex hormones.
Yeah, those little powerhouses.
Right. Well, aldosterone, one of those hormones, plays a key role in regulating potassium levels.
So are you saying that when the adrenal glands aren't working properly, it can mess with those potassium levels?
Exactly. You're right on track there. And when those potassium levels get out of whack, it can lead to some serious issues.
Okay, like what kind of issues?
Well, for instance, too much potassium, which is called hyperkalemia, that can cause muscle weakness, fatigue, even heart problems.
Oh, wow, that's pretty serious. No wonder you're emphasizing potassium so much. So how do these medications we're talking about, how do they fit into this whole picture? Are they all designed to lower potassium levels?
Not necessarily. Some can actually increase potassium as a side effect, while others are specifically designed to lower it. It really depends on the condition and how the medication actually works.
Okay, so it's not a one-size-fits-all approach then.
Nope, not at all. It's all about finding the right tool for the job, so to speak.
Right, back to that toolkit analogy. So can you give me some specific examples? Like, what are some medications that affect potassium, and how do they actually work?
Sure. So let's take amiloride, for example. I see you have it highlighted in your notes.
Amiloride, yeah. It's a potassium-sparing diuretic, right?
You got it. It's often used to treat high blood pressure and heart failure.
Potassium-sparing. Does that mean it actually increases potassium? That seems kind of counterintuitive if we're worried about too much potassium, right?
It does sound a bit counterintuitive, but it actually makes sense when you understand how diuretics work.
Okay, break it down for me.
So most diuretics, they work by flushing excess fluid and electrolytes, including potassium, out of the body through the urine.
Right, makes sense.
This can be really helpful for things like high blood pressure, but it can also lead to low potassium or hypokalemia.
Okay, so amiloride is different because it holds onto the potassium while still getting rid of the extra fluid.
Exactly. Amiloride works by actually blocking a specific channel in the kidneys that's responsible for reabsorbing sodium back into the bloodstream.
Okay, so it's blocking that reabsorption.
Right. And by doing so, it prevents that sodium from being reabsorbed, which then promotes the excretion of sodium along with water. That's what gives it that diuretic effect.
Okay, so it's getting rid of the sodium in water. Got it. But if sodium isn't being reabsorbed, how does that spare potassium?
Good question. So in the kidneys, sodium reabsorption and potassium excretion, those two processes are often linked. It's like a seesaw. As sodium goes up, potassium goes down.
I see. So by blocking that sodium reabsorption, the amiloride is indirectly preventing the potassium from being excreted.
Exactly. You've got it.
So it's like a two-for-one deal. You get that diuretic effect of getting rid of the excess fluid while also preserving the potassium levels. This stuff is amazing.
It really is remarkable, isn't it, how these medications can target such specific pathways.
Absolutely. Now, speaking of specific pathways, you also highlighted spironolactone in your notes. That's another one that affects potassium, right?
You're right. Spironolactone does have some effect on the kidneys, but its main way of working is quite different from amiloride.
Okay, so how is it different?
Spironolactone belongs to a class of medications called aldosterone antagonists.
Aldosterone antagonists, meaning they block the effects of aldosterone.
You got it.
Wait, did you mention aldosterone earlier? Something about the adrenal glands?
You have a great memory. Yes, aldosterone is that hormone made by the adrenal glands, and it plays a big role in blood pressure and electrolyte balance, including potassium.
Okay, so spironolactone blocks aldosterone, which is involved in potassium regulation. But how does that translate into, what we actually see happening in the body? Does it raise potassium or lower it?
Spironolactone, because it blocks aldosterone, ultimately leads to increased potassium levels. See, aldosterone normally tells the kidneys to reabsorb sodium and excrete potassium. So by blocking aldosterone, spironolactone kind of flips the script.
Ah, so it's like reversing those effects.
Exactly. It reduces sodium reabsorption and stops potassium from being expended.
Okay, so it's similar to amiloride in that it spares potassium, but it works in a totally different way.
You got it.
This is amazing. It's like we've got multiple tools to fine-tune those potassium levels depending on the situation. So cool. Now, speaking of having multiple tools, you've also highlighted another interesting medication, bromocriptine. This one seems a bit out of place, though. We've been talking about diabetes and thyroid medications, and now we're jumping to something that's often used for Parkinson's disease. What gives?
Bromocriptine. It's a great example of how interconnected different systems in the body can be. While it's commonly associated with Parkinson's disease, it also has applications in endocrinology, particularly for conditions involving high prolactin levels.
Okay, prolactin, that rings a bell. That's a hormone, right? But I'm still not seeing the connection to dopamine and Parkinson's. Can you, connect the dots for me?
Of course. So dopamine, it's a neurotransmitter that's crucial for motor control, things like movement.
Right, and Parkinson's is all about that lots of dopamine leading to those movement problems.
You got it. Now, what's interesting is that dopamine actually inhibits prolactin release from the pituitary gland.
Oh, okay, so there's that connection.
Right, so when dopamine levels drop, prolactin levels can rise, and that can lead to a whole slew of symptoms. Irregular periods, infertility, even milk production in women who aren't pregnant.
Wow, that's a lot of different things. So bromocriptine, since it mimics dopamine, can help lower prolactin levels.
Exactly. It's like hitting two birds with one stone, treating both Parkinson's disease and those high prolactin levels.
Wow, so it's like the same tool for two different purposes. That's pretty cool. Okay, so we've got amiloride and spironolactone for potassium, and then bromocriptine for prolactin and Parkinson's. What else is in this endocrinology toolkit of ours?
Well, let's talk about demeclocycline next. It's another one you highlighted in your notes, and it's quite unique.
Demeclocycline, yeah. I was puzzled by this one. It's an antibiotic, right? But my notes say it's used off-label for something called SIADH. Something about water balance, I think.
Demeclocycline is a great example of a medication being repurposed. It really emphasizes that we need to understand not only what a medication does, but how it actually works.
So how does an antibiotic end up treating a water balance disorder? I'm all ears.
Okay, so SIADH stands for Syndrome of Inappropriate Antidiuretic Hormone Secretion. Basically, your body's making too much antidiuretic hormone, or ADH.
ADH.
And that leads to, water retention and low sodium levels.
Right, makes sense. But where does the antibiotic come in?
Well, demeclocycline, even though it's an antibiotic, has this interesting side effect. It messes with ADH's actions in the kidneys.
Wait, so it's kind of like spironolactone, but instead of blocking aldosterone, it's interfering with ADH. This is getting complicated.
It is complex, but you're doing a great job keeping up. You're right, though. Demeclocycline basically acts as an ADH antagonist. It's fighting against the effects of all that extra ADH and SIADH.
This is incredible. Who knew an antibiotic could be used like this? It really shows you that you have to stay curious, right? Open to those unexpected connections.
Couldn't have said it better myself. And, speaking of those unexpected connections, your notes also mention something interesting about monitoring and education when it comes to these medications.
Yeah, I was struck by the fact that, well, almost every medication we've talked about has some potential side effects. Some of them are pretty serious. Seems like monitoring is really important for making sure people are safe.
You're absolutely right. Monitoring is crucial, especially when we're dealing with hormones. Even small changes can have a big impact. What exactly we monitor depends on the medication and the person's condition, but there are some common things we look for.
Like checking blood glucose for those diabetes medications, right? That one seems pretty straightforward.
Yeah, blood glucose monitoring is essential for anyone taking medications that affect those blood sugar levels, helps make sure the medication is working and the person isn't having any problems with their blood sugar going too high or too low.
Makes sense. What about other medications? Any specific things to watch out for with, say, the thyroid medications?
With methimazole and PTU, the ones we talked about for hyperthyroidism, we keep a close eye on liver function and white blood cell counts. Remember those potential side effects we talked about?
Yeah, the liver damage and the low white blood cell count. Scary stuff.
Right. So we do regular blood tests to catch any problems early.
Okay, that's reassuring. What about the medications that mess with potassium? Is potassium monitored routine for those?
Absolutely. For medications like amiloride, spironolactone, and even fludrocortisone, we watch potassium levels closely to make sure they're within a safe range.
So it's not just about popping a pill, it's about those regular checkups and blood work, making sure everything is running smoothly?
Exactly. It's a team effort between the patient and the healthcare provider.
Right, which brings up another point you mentioned earlier. Patient education. Why is it so important for patients to be involved in their own care, especially with these endocrinology medications?
Patient education is absolutely key. It's not enough for just the healthcare provider to understand these medications. The patient needs to be in the driver's seat, too. When patients are informed, they're better equipped to manage their condition and make decisions about their health.
So what are some of the key things patients should know? What kind of info do you usually share?
We talk about a lot of things, tailoring it to the specific medication and what the person needs. But there are some general things that apply across the board.
Like knowing the potential side effects and what to look out for.
Exactly. We want people to know about both the common and the less common side effects so they can recognize any problems.
Right, like we were talking about hypoglycemia with those diabetes medications. People need to know what that feels like and what to do if their blood sugar gets too low.
Exactly. And we also talk about lifestyle changes like diet and exercise. Medications are important, but often they're only one part of the picture.
Right, it's about the whole person.
Exactly. You got it. We're looking at all the factors that play into someone's health. It's a holistic approach.
This is all making me think about all the different things that can influence our hormones. It's not just about the medications, but genetics, lifestyle choices, environment.
You're absolutely right. It's all connected. Now, before we move on, I notice you have a section in your notes about some unique cases where medications are being used in ways you might not expect.
Oh, yeah. Like, I have a note here about bromocriptine for Parkinson's disease. Didn't we already talk about that one?
We did touch on bromocriptine, but remember that was in the context of its effect on prolactin. It is also used for Parkinson's, but how it works is slightly different.
Okay, now I'm intrigued. Tell me more. How does bromocriptine work for Parkinson's?
So, as we mentioned before, Parkinson's involves that loss of dopamine-producing cells in the brain, which leads to those movement disorders. Bromocriptine, since it's a dopamine agonist, steps in to help make up for that dopamine deficiency.
So it's basically mimicking dopamine's effects.
Exactly. It binds to those dopamine receptors, stimulates those pathways, and helps to improve symptoms like tremors and that stiffness.
That's incredible. So it's like the same tool for two totally different purposes. Amazing.
It really highlights how versatile some medications can be and how important it is to understand all the different ways they can work.
This is why I love doing these deep dives. You just never know what kind of surprising connections you're going to find.
Absolutely. There's always something new to learn. Now, speaking of those surprising connections, there's another unique case in your notes that I wanted to touch on. Demeclocycline, the antibiotic we talked about early, being used off-label to treat SIADH.
Oh, yeah. Can you remind me what SIADH is again?
SIADH, or Syndrome of Inappropriate Antidiuretic Hormone Secretion, basically means the body is producing way too much antidiuretic hormone, or ADH.
Right. Too much ADH. And that leads to water retention and low sodium.
Exactly. Now, remember how we said demeclocycline has this interesting side effect of interfering with ADH in the kidneys?
Yeah, it's like a secret weapon against ADH.
Exactly. So doctors sometimes use it to treat SIADH, even though it wasn't originally designed for that purpose.
So it's like a backdoor approach to treatment, using a medication in a way it wasn't initially intended.
You got it. It's a pretty neat example of how creative doctors can be. finding new ways to use existing medications.
This is fascinating. It's like a whole new world of possibilities opens up when you start thinking outside the box.
It really does. It reminds us to always stay curious and be open to those unexpected findings in medicine.
Well, we've definitely covered a lot today. I feel like I have a much better understanding of these medications now.
I'm glad to hear that. And remember, this is just the beginning. There's always more to learn.
Oh, for sure. But I do feel much more prepared to talk to my doctor now, ask the right questions.
That's what we like to hear. Informed patients make the best decisions.
Absolutely. And it's amazing to think about how all these medications show us just how complex and interconnected our bodies really are.
It really is remarkable. And how much we still have to discover.
Well, on that note, I think it's time for us to wrap up this part of our deep dive into endocrinology medications.
Sounds good to me.
But don't worry, everyone. We'll be right back to finish up this epic journey through the world of hormones and medications. Wow, what a journey this has been. It's amazing how those medications can, target those specific pathways and actually restore balance in the body.
It really is remarkable, isn't it? And we've only just scratched the surface.
I know, there's so much to learn, it's a little overwhelming. But speaking of scratching the surface, there's one more medication in my notes I wanted to ask you about. Potassium iodide. We talked about it briefly with hyperthyroidism, but it feels like there's more to the story there, like it has a dual personality or something.
You're very perceptive. Potassium iodide does have a fascinating dual role in endocrinology. So on the one hand, yeah, it can rapidly bring down thyroid hormone levels in hyperthyroidism, acting as that pause button, as you put it earlier.
Right, right. That analogy really helped me understand it. But what's the other side to this dual personality? What else is potassium iodide used for?
Well, this is where things get interesting. Potassium iodide also has a key role in radiation safety, especially when it comes to protecting the thyroid gland from radioactive iodine.
Oh yeah, now that you mention it, I do have a note about that somewhere, something about nuclear accidents and radiation. But I didn't really get the connection to potassium iodide. Can you explain that a bit more?
Sure. So in a nuclear accident or a radiation leak, people can be exposed to radioactive iodine, which can then build up in the thyroid and increase the risk of thyroid cancer.
Okay, so that's where the thyroid comes in.
Right. But potassium iodide, if it's given quickly enough, can actually saturate the thyroid with non-radioactive iodine.
Oh, so it's like blocking the radioactive stuff from getting in.
Exactly. Like a protective shield for the thyroid.
That's incredible. I never would have guessed that potassium iodide, something so simple, could be so crucial in radiation safety.
It really shows how interconnected different areas of science and medicine can be.
I'm learning so much. It seems like there's always more to learn, even about things we think we know. This whole deep dive has been a real eye-opener.
I'm glad you're finding it so insightful. But on that note, I think we've covered a lot of ground today with these endocrinology medications.
Yeah, I think so too. It's been quite the journey. We've explored everything from how hormones are regulated to the nitty-gritty of how these medications work. It's amazing how complex the endocrine system is.
It really is a testament to the incredible complexity of the human body.
Absolutely. Well, on that note, I think it's time for us to say goodbye.
It has been a pleasure exploring these topics with you. And thank you to everyone for joining us on this deep dive into the world of endocrinology medications. Remember to always consult with your healthcare provider for personalized advice and guidance on any of the topics we've discussed.
Well said. And until next time, keep those questions coming and never stop exploring.